Hello, everyone. Today is World Cancer Day. It's a day that has been set aside to create awareness about cancer, the global burden of cancer, and issues related to cancer. Obviously, if you're very conversant with our page, you will understand we've been talking about cancer at one point or the other, but we'll never get tired of talking about cancer. The reason is that just in the year 2022 and up to date, we have an average of 20 million new cancer cases annually, and over 10 million deaths that are related to cancer. However, in this particular episode, my interest and my focus will be on childhood cancer. So why talk about childhood cancer? It's important that we focus on childhood cancer because children are very precious to us, everybody knows. And then there is usually a lot of emotional attachment when situations that involve cancer are being discussed, especially with children. What are the possible causes of cancer? What are the possible things that can be done to support individuals with childhood cancer? What kind of tests can be done? How do we recognize when a child has a challenge? Now, typically, there may not be too much difference between adult cancers and childhood cancer. The major difference might just be in the sense that childhood cancers are not necessarily related to or are not caused mainly by environmental or lifestyle changes, because these are already children. They haven't even had an opportunity to express themselves. Most of these cancers are of genetic origin. And so it's usually a devastating news, usually something that is very emotional for the parents, for siblings, for relations, when there is an announcement of childhood cancer. So what can be done to, or how do we recognize that a child has a challenge that we could call cancer? I might even want to start by asking, what is cancer? Cancer is simply abnormal growth of a cell or tissue that is beyond the normal control of the human body. So to that extent, it's important that we recognize the symptoms and signs of cancer in children. Of course, the symptoms or the signs might depend on what type of cancer that we are looking at. Cancers in children can come from various parts of the body. We have cancers related to blood cells, the one we call leukemia. We have cancers related to bones, Ewing's sarcoma, osteosarcoma. We have cancers related to the kidneys, nephroblastoma. We have cancers, that are related to nerve tissues. We have cancers that are related to brain tissues and some other parts of the body. In general, issues like weight loss, pain, persistent fever that does not respond to regular treatment, nausea, fatigue, headaches, and sometimes swellings or lumps that are actually even visible to the human body. And sometimes the cancer might be so big that it comes out as a big mass going out from one part of the body. So it's, when these signs or symptoms are available, the father or the mother or the relation of the child should seek further help, in order to identify which cancer or is responsible. We also know that there are available modalities, imaging modalities, and I'm speaking about imaging modalities because that's where my strength lies. Imaging modalities like X-rays, like ultrasound, like MRI, like CT, like PET scan, even nuclear medicine procedures are all necessary to first do diagnosis identify the cancer. 2, allow planning for treatment, and even when treatment has started, to do follow-up on those treatments to see the extent of progress. Of course, these imaging modalities are also important for staging. What is staging? Trying to know, how far the cancer has progressed, whether it is spreading to one part of the body or it's now spread to every part of the body, a condition we call metastasis. Why do we focus on children's cancer? And in our environment, why is this also a problem? First and foremost, the survival rate for childhood cancer seems to be a little bit lower than the average global survival rate. Globally, over 80% of children diagnosed with cancer would survive. In our environment, it's far less, maybe up 20%, not just in Nigeria, but in many other low-income and sub-Saharan African sub-Saharan countries and African countries as well. The reasons are very simple. We have low diagnosis, low rates of diagnosis. People don't show up early enough for diagnosis to be made. We have limited access to healthcare facilities. We have issues of finance. We also have people not following up even after treatment has started. So these are challenges, and today we are just drawing the attention of individuals, public-spirited individuals, the government, donors, and policymakers to this issue of childhood cancer, to ensure that we we provide enough resources to support people who are suffering from childhood cancer. Also, that we could have dedicated centers for pediatric oncology centers or cancer treatment centers where children can be specially attended to when these issues arise. I believe that everyone whose child or relation or sibling comes up with cancer would want to do something about it, and we need as much support, financial, emotional, spiritual, and community support to go through it. That is the reason why we are doing this awareness program. And hopefully, I know that at the end, we would have drawn attention to the issues of childhood cancer, and we would, at the end of the day, provide alternatives. It's also important to know that some of these modalities that we are talking about to make diagnosis are available. They are available within our environment, and people can access them at will. Till our next episode on Ask Professor Felix, I remain your prof, Felix Erondo. You grab